Bay Bridge Health Network is an integrated delivery network comprising of 5 hospitals, 20 physician practices, 5 long-term care facilities, 2 urgent service medical malls, and an insurance plan covering over 3 million people within the San Francisco region. Implementing an electronic health record system at Bay Bridge Health Network will reduce operational costs by 10%, expand market share through visualization strategies, and improve patient care and delivery of care. The implementation of an enhanced EHR system can improve documentation, facilitate clinical provider order entry, and implement clinical decision support systems. Implementing an EHR at Bay Bridge Health Network creates several benefits for the overall success of the facilities. This can lead to improved patient care by providing centralized location for patient data, ensuring that this information is accessible to both healthcare professionals and patients. EHR implementation can lead to faster access to information and streamlined workflows, increasing efficiency and reducing cost. This implementation can also allow for seamless data sharing among healthcare facilities to improve care coordination. Identification and engagement of stakeholders are crucial to the success of the EHR implementation at Bay Bridge Health Network. Leadership is responsible for providing the project's direction and strategic planning, decision-making, and resource allocation. The IT department is responsible for all technical aspects of the implementation, including system integration, maintenance, and data migration. They also assist with technical issues before, throughout, and after the implementation. Quality improvement and regulatory compliance teams monitor the quality and improvement of services and ensure that the system aligns with regulatory standards. Clinical staff work directly with the new EHR system. User training is crucial for successful implementation. Vendors provide software and technical expertise regarding the new system. An article by Achara and Wirt states full engagement on the part of all stakeholders is needed to maximize the benefits of using the system. This high-level project timeline will serve as a roadmap to ensure successful implementation at all Bay Bridge Health Network facilities. An article from Curious states, using a proper implementation strategy for new EHR systems can facilitate success, minimize delays, and increase healthcare worker satisfaction. The initiation phase is months 1 to 4. It includes a thorough needs assessment, identification of stakeholders, creation of a detailed project plan and project charter, and evaluation and selection of EHR vendor. Next, the pilot implementation will begin months 5 through 7. The existing infrastructure will be assessed and upgraded as needed, and data migration and configuration will be done to ensure the facility's needs are met. After this, the EHR system will be implemented in one facility, feedback will be gathered, and adjustments will be made before the full-scale rollout. Following successful pilot implementation, the full-scale implementation phase will begin. This will include network-wide employee training and implementation of the new EHR among all facilities at Bay Bridge Health Network. This will take place from months 8 to 12. After the implementation, there will be continuous monitoring to evaluate performance and collect feedback from staff and users. Updates will be made to the system as needed in the future. 5 critical milestones that must be achieved promptly to ensure success of project include approval of the detailed project plan, vendor contract completion, infrastructure readiness, pilot rollout, and entire network implementation. Capital costs include vendor services, implementation salaries, software, hardware, and network cost. Ongoing operating costs include maintenance updates and technical support for the software and hardware, continuous staff training throughout the implementation and beyond, and governance to provide continuous improvement initiatives and enhancements. Attached is the HIT performer table for review. Throughout the implementation process, paying particular attention to managing and allocating resources is vital to the project's success. The cost and budget must be regularly reviewed throughout the entire process. Resources will be allocated for cost monitoring and control. It is also vital to ensure efficient time management throughout the implementation process. Project management tools such as Asana, Trello, or Microsoft Project will be used, and regular status meetings will be conducted to ensure timeliness of the project. Resources will be allocated to create a comprehensive staff training programs to ensure all users are knowledgeable and comfortable with the new system. Support and help personnel will also be appointed to assist with any staff issues. Again, project management systems will be used to track, monitor progress, and project managers will oversee milestones. According to the clinical teacher, the project manager keeps each piece of work on track, removes roadblocks, solves problems, and keeps the team motivated. A governance will be established to enforce continuous improvement, and regular feedback will be taken to adjust as needed. Before the implementation, it is essential to have a risk management plan in place addressing the technical, financial, and operational risk. The article Optimal Risk Response Plan of Project Management states, Project Risk Management Plan deals with identifying, assessing, and planning adequate responses to risk. Technical risk throughout the implementation to the system integration includes system integration, data migration, and interoperability issues. To combat this, importance must be placed on thorough pre-implementation testing to identify any technical problems and collaborate with experienced vendors to ensure there are no integration or interoperability challenges. A pilot phase can assist in the identification of issues before the full-scale rollout implementation. Financial risk include unexpected costs, delayed timelines, and the need for additional resources. Continuous financial monitoring and regular review of budgets with adjustments as necessary are crucial to mitigate these risks. Contingency funds should be set aside as well for unforeseen costs. Operational risks include workflow disruptions and resistance from staff. Developing a change management plan and a comprehensive training programs assist in alleviating these issues. It is also vital to continually support employees throughout the implementation and after. Streamlined workflows can lead to improved operational efficiency and reduced overall costs. Reliable and accurate billing processes lead to financial stability for the organization. An article from Healthcare Financial Management states, EHRs can help control hospital cost. To ensure success of the project, a complex evaluation plan must be developed, including both quantitative and qualitative metrics. Assessment of quantitative metrics include measurements such as reduction in operational costs, time efficiency, reduction in medical errors, and accuracy of billing. Qualitative metrics include the evaluation of user satisfaction, rates, interoperability measures, effectiveness of training, and workflow integration evaluation. This plan assesses the effectiveness of the EHR implementation. According to an article from the JAMA, scientifically sound measurements could provide an accurate and meaningful characterization on the current state of the EHR. When addressing key management stakeholders, it is essential for executive leadership, clinical leaders, and IT departments to be all aligned in the goals for the success of the project. The multi-hospital EHR implementation at Bay Bridge Health Network will improve patient care and increase operational efficiency while aligning with the network's goals and the implementation's objectives to provide a foundation for sustainable success in the future. Thank you all for taking the time to listen and for your dedication to advancing healthcare at Bay Bridge Health Network. If you have any questions, don't hesitate to get in touch with me at the email listed below. And here are the included references.